welcome to the podcast, Secrets of Success, with me, Dr. Shane Needham, where our theme is never be outworked. And I understand that you have a great personal story that'll definitely give that as a great example of never being outworked. And so before we get started, just a few introductions. Follow me on Facebook. We're live right now on Facebook. Follow me on Facebook, where you can also follow me on Instagram, on LinkedIn, or visit my website at drsneedham.com. I also have a YouTube channel where all my back podcasts are actually archived. YouTube, on Spotify, iTunes, and SoundCloud. I have the pleasure to be joined today by the Vice President and General Manager of Sciex. We'll talk a little bit about what Sciex are, who they are, and what they do in a minute. I am so honored to do this. And one of the things that we've talked about with this podcast is how scientists need to do a better job of getting out the information to the global community. And, we usually do that through white papers, through conferences for the general public. And I think that it's awesome. That usually does not disseminate information fast enough or in a manner where a lot of the general public can understand it, the non-scientists. So that's why we have a podcast like this. And I'm excited to give the voice of scientists to the global community. And that in the next couple of weeks, we have lots of great scientists that are really heavy hitters in the industry from great organizations as well, talking about some of the same types of science issues that we all know are important. And all of these things are, as you can see, important during quarantine that we've all been in lately. COVID-19 information and scientific information is very important as quickly as possible. So I'm hoping this podcast can help. So again, I'm Dr. Shane Needham. I am here with Aaron Hudson, and I just want to, Aaron, tell me your story. Tell me your background. What is it? Who are you? What do you do? Go back and be as personal as you want.
Okay. Well, first off, Shane, thank you for the introduction, and thank you for the invitation to be on this podcast. I think it's a great idea that you've got, making science more accessible to the general public. I think science it can be really complicated, but I think a lot of the fundamentals are relatively simple to explain. And I find it a lifelong interest, and I just love it. I think knowing more about the world around you is just so fascinating. But I grew up, and you may be able to tell I'm not American. I'm British by birth. So I grew up in the north of England, in a small working class town called Burnley, which is about 50 miles north of Manchester. And it was Burnley's like I say, working class. It was a bit rough, and so you had to be pretty streetwise as a kid growing up there. But it's a small town, and the focus of that town is really around football or soccer. The Burnley Football Club is where I spent a lot of my time, playing as a youth, trying to train and play football, soccer there. And so it was, it was an interesting childhood. I had a good family. My dad was he was a sales manager in a Johnson & Johnson's pharmaceutical company. Mum was an artist, so science and art together there. And it's set in the countryside, so I've always had an affinity for the countryside. And it's around, if you've ever read the novels or watched the film Wuthering Heights by Emily Bronte, those dark satanic mills, those the moors. So that's, I guess, where I feel most at home. And it was actually part of where the Industrial Revolution started. What would that be? A couple of hundred years ago now. And so there's a lot of mills. Not my parents necessarily, but my grandparents worked in the mills spinning cotton, and so the cotton used to come in from the British Empire, I guess, from India, and through Liverpool at the Manchester-Liverpool Ship Canal, and then it got weaved into clothes there. So, I guess background really from a working class time. At school, I was not necessarily a great student. I think I I kind of got by, but I was not top of the class by any stretch of the imagination.
Aaron, let me interrupt you. We have something in common. That's great.
Oh, yeah, great.
I was not a top student as well. I had to struggle. And I think that struggle is actually very important for success later in life because you have to work for it. So tell me more. I love your story. I love the story. You grew up in a small working class neighborhood, a rural community. I talk a lot about that. That's how I grew up too. And there's a lot of people that don't get to tell those stories. And not only can we be a voice for science, but we can be a voice for those people that didn't come from London or didn't come from New York City. And I love your story. Keep talking. I'm listening.
Okay, great. So yeah, not a typical student, not top of the class, but I think probably because I've got a bad memory, I think I've always found I love information, but I can never remember. I can never store the information. So I've always had to go back to basic principles and understanding. And I think that's actually helped me a little bit to try and simplify things. When you get something really complex, you want to bring it down to something that's understandable. So anyway, I didn't do great, but I did well enough to get to university. And I stayed in the north of England, but moved over. There's a row of hills right up the centre of England called the Pennines. And so I moved over the Pennines from Lancashire to Yorkshire, which, if you've ever heard of the War of the Roses and things, those two places are always, still some bad blood there. But I went to university in Sheffield in Yorkshire and stayed there for about 6 years altogether. I did a degree and a PhD. I came out with a PhD in molecular genetics.
Wow. Wow.
Yeah, I still...
Now, is Yorkshire, is that,
so surprising.
is Yorkshire, is that near, so I visited England, well, I've been there 4 or 5 times, and a long time ago, 20 years ago now, over 20 years ago, actually, I was there and we went up to York. Is Yorkshire near York?
Yeah. Well, York is, I suppose, the state capital of Yorkshire.
Oh, okay. Okay. Got it.
Okay. Just south of York. It's about 30 miles south of York, I think. But York's quite well to do, actually. And York actually was the centre of when the Vikings invaded. So I love history as well. Like I said, I like the information. I can never remember it. But the Vikings invaded in, 600 AD and made their centre in, they called it Jorvik at that point. And so established Danelaw as the half of the country. It wasn't England at that point, or Britain anyway, and so half the country was under Danelaw and the other half was under, whatever the others were, the tribes.
That's fascinating. And we had a great time in York, and it was just the history and the Roman roads, and that's as far as incredible. So it was a really, really good time. I every time I go to England, I love it. Every single time. Yeah,
me too.
Well, what a great story. So you got a PhD in molecular genetics, and then what? Then what?
Yeah, well, and so that was my first introduction to something called mass spectrometry as well. We'll maybe come on to that later. I'm sure that's going to be a feature here. And that was 25 years ago, 30 years ago, and actually, it was one of the first times that mass spectrometry had been used to look at a protein, a big molecule.
Wow.
Normally, you look at small molecules, chemicals, but that was. I remember to this day because as a trainee scientist at that point, you would try and work out. Okay, you've isolated a protein. You want to try and find out as much as you can about a single protein in the cell. This was actually a protein in a bacterium called Escherichia coli, which is a good bacteria in the gut, but can cause a lot of bad infections and diarrhea and things as well. But once there's this big protein in there called ferritin, and it stores iron in the center of it, because iron is really important for just normal functions of the cell. But if you get too much of it, it becomes toxic, so you need this buffering capacity there. And I remember I'd isolated this protein, and it was, I ran it on a gel. So you get this, like you do filter paper, you put filter paper into a colored liquid and it separates. And so that's the kind of idea of this gel. And so I was separating the protein. And the molecular weight of it, the size of it came back to something like 18 or 19,000.
And that's
that's pretty good.
And that was via gel separation, correct?
Gel separation.
Since Aaron, since we have quite a few people that don't understand chromatography and gel chromatography and gel separations, let's just back up a little bit, and I'm just going to try to put it in layman terms and help me if I need it. But so what Dr. Hudson is trying to do with his graduate work is he's taking a protein from a cell, and this is a very large molecule. So let's just try to compare it to something like sugar. That's a small molecule. Okay. That's a small molecule. But now you're going to look at this protein, let's just call it like DNA or something. Let's call it something like that maybe the general public can understand. Now he's trying to find the molecular weight of that. How much does it weigh and what is the structure of it? Would you think that that's accurate, Dr. Hudson?
Yeah, absolutely.
Yeah.
Absolutely.
And so,
because it's one of the properties, right? You want to know, it's one of those things that helps you identify and characterize what it is.
And so it really revolutionized. So in the past, you would put this, let's just say this big or large small molecule on a piece of paper, and the faster ones, all of them went different speeds based upon their molecular weights. And let's just say the bigger ones went slower than the smaller ones. Would you say that's accurate, Dr. Hudson? So that's how you told the molecular weight. It was a big guesstimate. Okay, so that's where he's at before he uses mass spectrometry, which is a better way. It's like a molecular scale, like a molecular way to weigh things. So now talk about, you've got this protein, 18,000 AMU or Daltons in molecular weight. Look that up if you have to. Now what do you do with it, Dr. Hudson?
Well, so on this gel, it's somewhere between 18,000 and 20,000 molecular weight. And I thought, okay, well, that fits reasonably well with what I thought it was. And I then ran it on a mass spectrometer, and the result came back, and it just floored me, because this result came back and said it's 19,424.3 molecular weight.
So is that exact?
I just blown away. I thought, my God, what's that? Are you sure? Totally accurate, false precision.
Now, what was that?
No, that was it.
Was that using ESI or MALDI?
No, that was ESI, actually. Yeah, much more accurate technique, electrospray.
Wow. Okay.
Yeah, so that was my first introduction to this technique, and I just thought, my God, that is just so precise and so accurate. Yeah. And then after I finished my graduate work, I was looking for a job, and funnily enough, my girlfriend at the time, her mother was selling photocopiers to a small company in Manchester that happened to be this mass spectrometry company. And I thought, well, I'll go and have a look. And so I did, and the rest is history. I got a job there, and since then moved from this small company in Manchester to with different roles. I was actually a scientist for that company, but I really wasn't much good at it, to be honest. So they moved me into sales and did a long time in sales, and like 10 years selling in the UK, and then moved over to a different company, Sciex, the company I worked for. And in 2006, moved over to the States to take another role at headquarters. And since then, I've been working in different roles in commercial, in product management, in brand, in strategy, business unit management. So that's pretty much where I'm up to now. And I now live just outside Boston with my family, wife and 2 kids.
That's awesome. What a great story. So tell us about, you've been talking about Sciex. You work for Sciex now. You're the vice president and general manager. So tell us about Sciex, and I would love to kind of chime in here too, because I have some great stories about Sciex. Not only my current company, Alturas Analytics, we're a Sciex shop, and I've collaborated with Sciex for many, many years. When I was at Pfizer, I used Sciex, and I've got some stories there too. But why don't you tell our audience about what Sciex is, their history and their tools. Tell us a little bit about that.
Sure. Well, it's a 50-year history. This is our 50-year anniversary.
Yeah, congratulations. That is awesome. Yep.
Yeah. It came out of the University of Toronto. Sciex the name was Scientific Exports, which got shortened. And I think it's one of those stories where you start with a technology that you don't really know, how it's going to be adapted, but it's both a blessing and a curse for mass spectrometry. It is probably the most powerful technology to be able to identify and quantify molecules in complex samples. And so, identify what's there and then quantify how much is it. And complex samples, that would be things like, groundwater, if you like, maybe not that complex, but then food, oranges, apples, blood, plasma, you name it. It pretty much can take a really complex sample, do that chromatography that we talked about, that separation of the molecules first, and then identify and quantify everything that's in there. Or something you can target and be specific about it. But I would say we are the acknowledged leader in the quantification, the accurate and precise one.
Absolutely. Yeah. So he talked about chromatography and mass spectrometry. We're not going to spend a lot of time on that, but it has revolutionized the way we measure everything in the world. It fascinates me. My PhD is based upon chromatography and mass spectrometry, and I am like a lot like Dr. Hudson. Not only do I like history, but I like science. I like information. I do, unfortunately, remember a lot of things. There's an advantage and a disadvantage to that. So I carry a lot of information in my head. But chromatography was invented, again, most of these tools, mass spectrometry, although it was invented in the early 1900s, it really, it took a different, it just has been never plateaued, and it keeps gaining in more and more technology advancements. Chromatography was invented about the same time, as about 1890s. Chromatography means color writing, and it was invented by a Russian chemist named Michael Sweat. You can look him up, but he separated the color of leaves, the chlorophylls in leaves. And so when mass spectrometry was able, the detection of weighing things, so to speak, was able to be coupled with chromatography, especially using liquid, we won't get into that too much, it revolutionized what we could do and how we could measure proteins and biomarkers and things biologically. And all your tests that you take for, a lot of your biomedical tests, a lot of this is done via chromatography and mass spectrometry. A lot of it is, and that's the most accurate and probably precise tool to do quantitative analysis. So Sciex has been a leader in that. I got to tell a quick story here, Dr. Hudson. So when I was at Pfizer, I worked in, I guess probably, they were the first group in the world to buy an LCMS instrument from Sciex, and it revolutionized how to do therapeutic drug development. And so when I worked on the first instrument that was in the industry, and it was labeled serial number 2. Now the story there, and you'll have to go check this out. The story actually from Tom Covey is that was actually serial number 1. They didn't have enough money to make serial number 2, but they put serial number 2 on it, so we didn't know the difference. And then when they got the money, they built serial number 2. So I actually worked on the very first LCMS, API 3 from Sciex in the industry, and it revolutionized what we could do with quantitative and qualitative measurements as well. And so you are right. Self-proclaimed Sciex is a leader in quantitative analysis for LCMS. That is absolutely true. And I only see that continuing on the horizon. You guys do a great job. So really good job. So continue. Sciex history and tools. Tell us a little bit more about it.
Sure. Yeah. So, you mentioned there the API 3 that came out 30 so years ago. Probably aging both of us now. I was still in school at that point, obviously. It really started by the original instruments came from environmental testing, and they were put on a van in Toronto to look at these environmental, crises that came out and monitoring the atmosphere and things. But then it quite quickly, Tom Covey, you mentioned that, and a few others that are still outside in the R&D team, worked out pretty quickly how you can then say, well, let's start to analyze liquids as well. And I think that was the issue there about now you can analyze the liquid. How do you get that into the mass spectrometer? And that interface there really was the basis of what you're talking about with the API3. But it's gone on from strength to strength then from there. And it's actually, because one of the features that you want to do is to look at the highest sensitivity, right? You want to increase in sensitivity. The more sensitive you can be, the more accurate
and what
can be about anything.
And what sensitivity means is that means you can detect lower and lower levels. And so I want to describe to the audience what levels we're talking about here. So when you talk about part per million levels, that means 1 1/millionth of a part in a lot more, right? So 1 part per million. Okay, that is equivalent to approximately a sugar cube in a swimming pool. That's what you can detect. Now, part per trillion levels, which is what we're detecting now and less, is 1 single grain of sugar in a swimming pool. It's still
swimming pool.
Yeah, exactly. In an Olympic-sized swimming pool. And it's fascinating to me. It almost is unfathomable to me. But anyway, so go on about sensitivity. Talk about that.
Well, okay, so let me blow your mind a little bit more. We're about to bring out a new system that can detect 1 grain of sand. 1 grain of sugar. Like you get get a grain of sugar, right? That's from your cupboard. Put that on the end of your finger. So 1 grain of sand in 10 Olympic-sized swimming pools.
Oh my goodness! Unbelievable. It's
now,
not. Yeah.
The other thing is it can do that. It can look for that, so it can detect that 1 grain of sugar. It can do that 200 times a second.
Amazing.
So that's faster than a hummingbird flaps its wings.
Wow, that is just incredible. Incredible. Wow.
We've just come out with something else, this new system that can do that 3 times a second. So you can look at 3 samples every second. Looking at 200 things in 1 grain in 10 Olympic-sized swimming pools. I mean, it's just phenomenal.
It is phenomenal. It's almost, to think about where we've come from is really, really incredible. So really a good job. So what would you say, before we get into talking about the illness to wellness model, and that's a great story, and precision medicine, can you tell us a little bit more about Sciex and what is the vision and mission of Sciex?
Yeah, well, if you think about what you can use this for now, there's a few different areas. So we talk about environmental. So now think about pesticides, right? Pesticides in the food, pesticides in groundwater. There are governmental regulations that say you cannot put too much pesticides in. They're obviously toxic for humans. So a lot of the food testing that is done, probably the majority of the food testing that is done, uses LCMS, the technologies that we've got to see whether the residue levels are below those regulatory amounts. So that's one thing, testing the environment, testing the food. The other thing in the environment is, I don't know whether people have seen it, but there's a film called Dark Waters in Hollywood movie with Mark Ruffalo.
Ruffalo, yeah, okay.
And that is around PFAS testing. And so PFAS, those are, I think that's right, polyamphofluorinated alkyl substances. And they're used in fire retardants and non-stick pans and things. And they don't go away.
Yeah.
These things are so solid that you just can't get rid of them. And they're toxic.
They don't break down at all. Yeah.
They don't break down, and they're accumulating and causing all sorts of health problems.
Wow.
And so now you really want to know that there's very little of that around, so more sensitivity is better. And the European Union has come out with new guidelines to reduce those limits even more. So, that's why we need the sensitivity to test ever diminishing levels.
Yeah. Well,
sorry.
Well, just tell us more about the vision and mission of Sciex, because there's so many. What I want to tell people, that's what I love being an analytical chemist, and I've always wanted to be one, and I am one. I'm living the dream. Is that measurements are incredible. We always have to make a measurement. It always has to be as accurate as possible, and we have to be able to defend it, and we have to have confidence in that data, and it also has to be as low a level as possible. So here's always the question that I get asked all the time, because my company buys lots of instruments, and we get feedback. They want feedback and so on and so forth. How much sensitivity do you need? That is an easy answer. It's not an answer. It's an easy comment. How much can you provide me? I always need more. Always. Yeah. Always. Yeah. It makes things easier. And what I like about analytical chemistry, Dr. Hudson, is that the more we can measure, the more information we get, and then the more we can do. And it's a never ending cycle. That's what I love about it. It's like we just keep getting more and more information, and everything requires an analytical measurement. I don't care if you're a biologist, an environmental scientist, a food scientist, it always requires some kind of a measurement. So what is Sciex' role in all of that? What is I guess, can you say in a few words what the vision and the mission of Sciex actually is?
To provide ever more accurate and precise quantitative measurements for molecules to impact human life everywhere, globally.
I love it.
Well, it's funny you talk about that quantitative measurement. I thought of an analogy the other day, actually. If you were, so why do you need to quantify things around you? So this is kind of the fundamental principle of everything that we do, right? We probably subconsciously we do this on so many levels, even on our bank accounts and economics as well.
Sure.
But let me ask you this question. I hope this works. We've not planned this, but let me ask you this question. If I was to say to you that you have just won the lottery, what's your first question?
Okay, so ask that again. I want to understand it.
I'm going to tell you now that you have just won the lottery. What's your first question?
I have won. What is it?
Well, your first question, we should have planned that. Your first question is, well, how much have I won?
Yeah.
How
okay.
much? Tell me how much. If I won $1, I'm not interested. But if I've won $100 million, then I'm really interested. So it's that need to quantify things is just pervasive through all of our lives. And you can either quantify them in a way that is either relative. So, if we both won the lottery, I'd won 3 times more than you. Well, okay, if I won $1, it's still not important. Or they can be absolute, where you say you have won, $23,000 on the lottery. So that's the same principle really behind the analytical chemistry and the studies that we do. Is that really, is it is it a relative amount? We need to know the up and down regulation of protein.
Yeah.
So to apply this to things like disease research, if you're doing things like proteomics, looking at all the different proteins in a cell, in a control sample, a normal sample compared to a disease sample, you want to know which ones are up and down regulated, because they are the indicators, the biomarkers of what's going to be essentially how you can measure that disease.
Yeah, absolutely. That's the reason we need to know. And that's what if we just think about it from let's just say a health perspective of somebody maybe that's monitoring their cholesterol level, and either they're going to change their diet, or it's either going to get better or worse, their cholesterol, right? So you monitor it over time. So does it go down? Does it go up? And what happens if you eat certain things? And so you're exactly right, Aaron, is that it's very important to know quantitatively what are those numbers and what's happening. And you have to know those within, it depends on the area, but plus or minus 10, 20, 30%. That's very, very important, because the difference sometimes between disease and not disease is within that area. And so I love it. I love your guys' mission. I love your vision. You guys make great, great tools. And so we've talked about mass spectrometry, we've talked about chromatography and how it's used, and the little bit about Sciex and the history and its tools. And by the way, I visited Toronto. Oh my goodness, the Sciex shop several times. One time it was, this goes back to 1995 or 6, and I liked it back then, and I still like it. My point of it is, you just told me what Sciex stands for. I've never heard that before. I've been working with Sciex for 30 years, and I never knew it stood for scientific export. So thank you for telling me that. I love history as well. So, so tell me a little bit about the recent illness to wellness model, and how precision medicine fits in there, and what is precision medicine. So I'll just let you go. You just kind of let it flow here, but describe that to me. And it sounds like you may have a good story about that.
Well, I'll do my best. I think, it's obviously a complicated area, but I think it's fine. And, if you wake up in the morning and you feel a bit under the weather, right, you feel a little bit ill, or just, maybe not enough to go to the doctors. But you can't really quantify that. You can't decide how that level of wellness. Because wellness is really an abstract term. And you can see we're starting to be able to measure so many biometrics, things like your heart rate on these trackers, how many steps you do a day. But there's no real way to measure wellness at the moment. And I think what we need to do is to shift. I don't know whether you know it, but the cost of human health around the world is something like $10 trillion spent on fixing people. People that have got to.
Oh, I'll give you. Aaron, I had a podcast about this. I'll let you. Yeah, absolutely. And it was about kind of we have a chronic disease problem in our country. I'll give you the numbers in our country. So 70% of morbidity and mortality comes from chronic disease in our country, and that cost in our country alone is over $3 trillion in the United States. And the thing of it is, why it's important, the tools that you're developing and the mass spectrometry and the science and the chromatography, is because I don't care where you're at and who pays for what, that model is unsustainable. We can't afford it economically, and it's really a threat to all of our societies and all of our communities around the world. So using technology as much as possible to try to get people well, I think it is fabulous. So continue.
Well, yeah. So I think, like we've established, we don't necessarily want a long life or a longer life than we've got. Maybe some do, but if it were up to me personally, I'd like a healthier life.
Right.
But I'd like to have the 40 years and 10 that were free of disease and as healthy as I could be. So I think there is this, and then again, if you can keep people well, then you save all of this money. You can put that into different areas of research. And so I think it's just this drain on society around, and it's a break-fix mentality. So, like, if you don't wait for your car to break down on the freeway,
right?
You take it for regular preventative checks. And so I think we need to shift to that. But the problem is, regular preventative checks, okay, you can look at cholesterol and things and biomarkers, but there's a whole lot of other things that are going on there. And they don't really tell the whole story about what's happening in the human body. And it's the old adage, you can't manage what you can't measure.
That's right.
Right. So we need to get these, I think we need to shift away. I'm probably just one voice. I don't think I'm the only person saying this. We need to move away from the this break-fix mentality
Absolutely.
to measuring people's wellness.
Absolutely.
Over a period of time. But the technology has not been there to do that until recently. And I think it's starting to come of age now.
So that's great. Hey, you and I are on the same page. I think we need to move from what I like to call it, because I also have a podcast and it's just a passion of mine about healthcare, or our current model though is sick care. It's not health care. We fix sick people is what we do, and that's not sustainable. I love that you're talking about it and you're passionate about getting people well. It's about a quality of life, and it's our responsibility to do that as well. And also, obviously, with scientists and technology and manufacturers and vendors, we can all work together, and academics, we can all work together and have more wellness in our societies. And so, talk about precision medicine. What does precision medicine mean to you? And again, try to describe that to the non-scientist who may be watching, that what precision medicine is, and give an example, because everybody has used precision medicine in the world. From the time you're a newborn and your blood is screened for certain disease until the time you go to your annual or your semi-annual doctor visit and you get your finger pricked, you're getting screened and you're using precision medicine. Describe that to us, Aaron.
Yeah. Well, it's not precision medicine. I think it's I don't know what, I'd probably argue that that's not quite precision medicine. I think that is an attempt to tailor existing general procedures to people, but I don't think it's precise. It's probably just, best effort. But I think this shift now to precision medicine, because we're all genetically different, right? So if you're given, if you go to the doctors and they diagnose you with something, they're not going to necessarily give you a specific treatment based on who you are. They'll give you the same treatment that they give to everybody else.
That's right. That's right.
So that's not precise, I don't think.
I like, so what you're saying is precision medicine, how we use it now, is really a misnomer. Am I correct that's your thinking?
Well, I think there are some examples of precision medicine. So I think we're shifting away from that to precision medicine. I can give you an example of breast cancer is probably the best one.
I'd love to hear it. Okay.
So if you think about it, we're all genetically different, right? So I'm genetically different to you. You're genetically different to your brother. Women are genetically different to men, right? You've got the sex chromosomes, the different proteins and things are expressed from those. And in fact, when you think about it, the drugs that are developed tend not to take that into account, right? You get clinical trials of a group of studies that are not necessarily representative of the entire population. So
correct.
Used in clinical trials, they will work pretty well for some people, but not for others, those drugs. And did you know that the sixth biggest killer in the US is adverse drug reactions?
Interesting. Right? I did not know that.
The drugs that we give people to make them better can kill them, because we all react to them different.
Right.
And even developing mice models, right, was certainly different than mine. So really, precision medicine for me is to get the right drug to the right person at the right time. And it's probably as simple as that.
I like that model. Can you describe a specific example maybe that you have? You talked about breast cancer, but and also put in there how mass spectrometry or some of the Sciex tools would be used.
Okay, yeah. So breast cancer is a good example, I think, because many people have heard of Hudson. But what happens, when a woman goes to the doctor, she gets a mammogram, perhaps to find a lump. If that lump needs to have a biopsy, they will take a tissue sample, and from that tissue sample, they do something called an H&E stain, which says, and really that's just going to say, are the cells cancerous or not?
Sure.
That was as far as it got until, a few years ago, maybe 20, 30 years ago. And in that case, we used drugs like tamoxifen. Tamoxifen was developed clinical trials using Sciex equipment. Probably, that's similar types of work to what you do, Shane, right?
Sure.
Doing these clinical trials.
Sure.
But then the advances come when you look at, they will now do a secondary staining in histochemistry, where they look at three protein receptors on the surface of these cells. You can imagine these cells are balls, and then you've got these receptors that accept signals in. And you look at the progesterone, the estrogen, and the herceptin, the HER2 receptor.
Yeah.
And if you're HER2 positive, they will now give you a herceptin drug, which will aid your treatment. So it's become a lot more treatable. Breast cancer has become a lot more treatable because it's now being very specific. They don't give you herceptin if you don't have that, if you're not stratified as having that HER2 receptor. So that's probably a good example of that. And herceptin as well is a drug, small molecule. I think it's a small molecule drug, is it? That was developed using Sciex equipment as well, again, with a clinical trial. I'll give you another example, actually, a really interesting one recently, was around COVID-19. Because you can see that we're all, the research that's being done now shows that we're reacting differently. Different people are reacting differently to the virus. You see that in the nightly news.
Yeah.
And there was a new publication by Professor Marcus Rauster from the Crick Institute in the UK. And he did this study in 3 weeks, right? I mean, this shows you how far the technology's come. This would have probably taken 10 years.
Wow. Amazing.
10 years ago.
Amazing.
3 years. Right? He's done a proteomic analysis of, I don't know how many samples, maybe 100 patient samples, and compared people, what we call metadata, right? The way that the way that the pathology has progressed in those different people. Compare that with the underlying molecular response within that cell, just the protein. I looked at the metabolites as well. And what you can see is that one of the outputs of that paper is that there's this something called the cytokine response, this inflammation response that kicks off as soon as you get an infection, and which really helps the immune response kick into gear. And he found that, and his team find that a lot of the modulators of that are different across people. So the people that react more fiercely to this virus and get all of this, this inflammation in the lungs and things, have a slightly different makeup of their immune response compared to the people that don't.
Interesting.
So again, precision medicine, right?
Wow.
Stratification of patients.
That's great. I mean, that's like a real-time study. That's fascinating to hear.
Yeah.
I mean, that's
published a week ago, I think.
I mean, that's, we're only months into the COVID-19, really. And to think about that would have taken, and it actually came out in a publication as well, that would have taken years before just to do the study. I think that's incredible. So I love to see how technology has advanced. I think it's been a really great thing for the globe. I mean, the global community has really benefited. That's what I liked it. That's what I fascinates me every day, and I'm passionate about it. You can tell you are too, Aaron, but I get to be not only a scientist who plays with some cool tools, mass spectrometry and chromatography that I love, but it actually has a benefit to curing disease and helping people. And I love that. That's what gets me out of bed every day. And I just love helping people. So that's awesome. You can see your passion. So I think I can hear what you're talking about when you talk about the future. You talk about precision medicine, what it's going to look like. So I want to know, so precision medicine, what does it look like in the future? And I want to give you my 2 cents too. And I think we might have some similar stories.
Okay, fine. Well, let's level set on what molecules are in the body to start with, because a lot of stuff in there, but there's really only 5 types of molecules. I'm simplifying. So you got DNA, which is the genetic material. That's the kind of what you could get in the future, the predispositions you'll have. You've got proteins. You got RNA. You got proteins. You got lipids, and you got metabolites. And if you think about that as what those things do, the DNA is really the kind of architect drawing, the blueprint. If this were a house, for example, the architect and blueprint. The RNA is the information that the architect gives to those different functional teams within building the house, like the plumbers, the electricians. The proteins are the structural things, like the bricks and the mortar that build up the hive. And then you got the metabolites and the lipids that are really the utilities of the hive, right? What has the electricity, the water. So, yeah, if you think about the human body in those respects, so just level setting on what molecules we've got. So at the moment, a lot of precision medicine is built around DNA, around genetics and genomics and next-gen sequencing. But to me, we're just touching the surface, because it really, if you think about, your DNA, you're given every cell of your body, mostly, I think, every cell of your body has exactly the same DNA from the day that you're born until the day that you die.
Yes.
Now that's not quite true, right? I'm
of course.
You get mutations in there and things. You get epigenetic changes, but essentially it's going to stay the same. So what the future really lies in, every baby that's born is going to get its DNA sequence, and from that, we'll say you've got the propensity for the 5 or 6 different diseases during your life. But that's where it ends for the DNA. What you then need to do is to say, well, if you've got those 5, 6 different diseases, let's say disease 1, I know now that I've got these markers, these 20 different markers that will show me the onset of that disease. But I also want to be able to measure what's called the exosome. We talked about PFAS, right? These contaminants and toxins. So you need to measure those as well. So you can have a bunch of things, proteins, lipids, and metabolites that you're measuring along with these chemicals. And at some point, you're going to split from wellness into illness.
Yeah.
And now you can measure that, because you've got this, the adage, you can't manage what you can't measure. Well, now you can measure it.
And you have a baseline. You have a baseline of what that, absolutely.
Right?
Yeah.
So you need to do that longitudinally, which can go over a period of time. Now, you're not going to be able to do that. There's no way that any of us are going to go and give an armful of blood every month or every week. So you need to do that from a drop of blood. And we just talked about the exquisite sensitivity of mass spectrometry. Well, that's no problem. We can quantify 5,000 proteins from a drop of blood, 1,500 metabolites, 1,000 lipids. That technology exists at the moment to do that. So you're slipping from wellness into illness. What happens then is that you will, based on your genetic profile, the doctor will know what disease you've got. Based on your genetic profile, there'll be a number of drugs that they could treat you with for this disease, probably some of these new biologic drugs or different cell and gene therapies as well. But they will know from your genetics that some of them are going to work better than others, and so they'll start you on the one that doesn't cause as many side effects first. And so that's a kind of precision treatment, if you like. You've got this precision diagnostic to start with, and then a precision treatment. And then you need a bunch of things to say, well, how are those treatments working? Are you slipping back into wellness? Are you moving? Is it being effective? And there's not much research going on around that at the moment that I'm aware of. But I think to be able to measure, again, these key performance indicators, if you like, to see whether you're going back to that baseline, will be the next wave of measurements that we can do. So really, we're all going to be just a pinprick of blood in the comfort of your own home. You'll send it away to reference labs like yourself, and the results will come back. It'll be on your iPhone, and you'll get a message saying, you know what, it's probably time that you went to see the doctor.
That's incredible. And I think we're moving in parallel lines. And, we don't know what we should measure until we know what we need to measure. And I know that's a weird question, but we're going to be discovering this, we're already discovering it. And I like what I just it got me thinking when you talked about precision medicine, a little bit. It was one of your comments. I don't remember exactly what it was, but precision is such a relative term. And what was precise 30 years ago is not precise now. And so we change that bar all the time. And what's interesting, what I like that we individualize, and you're really, what you're talking about is personalized medicine. And I totally agree with that concept. Now, right now, we really don't treat people that way. You know, if you have a headache, you take 3 ibuprofen, and everybody takes 3 ibuprofen. And I'm not saying that that's the model that we have right now. I'm not saying it's catastrophic. What I'm saying is that we could probably do better, correct? And so what I see is just like you. We're going to be, and everybody, as a scientist, I would measure myself all the time. That's the problem, you know, but because I like data, I see it even going a little bit further. I'm not sure if we'll always ship our blood somewhere. I don't know if we'll go to a Walgreens or a CVS and there's a mass spectrometer in there, and you know how we take our blood pressure and we can take them, you know, it used to be that's what you had to do to take your blood pressure. You had to go to the doctor, and then they started having these blood pressure cuffs in pharmacies, and now you can order them off Amazon and do them in your home. Now, I don't know if the technology will get to the point where we can do it ourselves. You know what, Aaron? I wish it would. I really do. Here's what I can tell you to give you an example. I have a son who's a type 1 diabetic, and he's very, very healthy, by the way. But it's only been 30 years that we have handheld blood glucose monitors in our hands. 30 years. Before that, you would have to go to the doctor, and it was called this, what'd they call it, a glucometer or something. And you would actually have to either get like a mil of blood, 1 milliliter, which is, by the way, a lot, and sometimes even more, or you would have to analyze your urine. That was even worse, and you'd do it once a month, and it was horrible. The outcomes were horrible. Horrible. Now, if you control your diet and you control your blood sugars, type 1 diabetic, you can have a very, very healthy life and long life. But will we ever get to that point of handheld? Now, I love mass spectrometry, by the way, as you know, and I'm sure I love to be involved in these conversations that you guys have, because the one issue with personalized medicine and mass spectrometry is you have a big, large, expensive vacuum pump. However, ion mobility spectrometry, that might have a future. Now, this is a whole other conversation. There's all kinds of issues with ion mobility mass spectrometry. And so anyway, I don't know. And I know you guys have some of those devices as well. And so I want it to be, what I like, Aaron, is that people can be responsible and accountable for their own health as much as possible. And so if we can make not business to business tools anymore with a manufacturer or a company like Sciex, but if we can actually sell tools to individuals, think about that market. It's huge.
I know.
And think about that. The health outcomes, they're going to be much, much better. And so that's what excites me. Will we get there in my lifetime? Maybe not. But you know what? To work on it and be a part of that cure is really, really cool to think about. And so I love it. I love it talking about precision medicine with you and personalized medicine. By the way, I usually take a 1-minute clip or so, and I kind of highlight our podcast, as you've probably seen when you've researched podcasts. I love that you broke down the body in 5 molecules. That was awesome. That it's true. I've never really, I mean, obviously most scientists know that, but I've never had it simplified like that. And that's what I liked about how you talked about early on. You said science is actually not that complicated once we simplify it. You're so correct. And here's what I can tell you as a C student. Yeah, I was lucky to sometimes get C's. I had to simplify it as much as possible. And I still have to today, because it can get so complex and overwhelming. And so thank you for simplifying that. That's going to be our highlight for our clip, by the way. So really, really good job. And so this has been great. We're getting ready to wrap it up. And so one of the things that I wanted to ask you, as you know, our theme is never be outworked. And I love your rural story. I love, your I guess your challenges in university, your challenges in academics. It sounds like you may have wanted to be a scientist, and then somebody said, "Oh no, you're not really a very good scientist. You're going to go into sales." And so those are all things that we don't expect, but it gives a theme of never be outworked, and I can tell that you have that, Aaron, and it's really great. It's been a pleasure to have you on the podcast. I want to ask you this question. You tell us about one apparent failure that you had in your life. And this may be something that you thought you failed at, or maybe somebody externally thought you failed at, but it actually turned out to be one of your best successes ever? Can you describe one of those?
Yeah, I can actually. I'm going to have to go back a little bit though to, I must have been about 18 years old. And so this was just after college, before university. I took a gap year in this small working class town. And I thought, you know what, I got to get out. I got to do something different. I got to see some of the world. So one day I packed my bag and got on a train and said to my parents, I'm going to go and live in France. And I went out to France, and it was, I didn't really speak much French at the time. And this was like 40 years ago, you know, so it's not even that long. But, you know, this was pre-Euro, pre-Channel Tunnel. And so it was a foreign place at that time.
Wow.
And I bummed around France. I hitchhiked. I worked in factories. I got a job as a shepherd for a while.
Wow. So you were in the countryside then?
Yeah.
Wow.
But after 3 months, I was young, right? Talk about youth, exuberance of youth, and thinking it will be all okay. I got all my money stolen.
Oh my goodness.
But so it's a really traumatic experiences actually. And I came home. I just said goodbye to everybody, my family, and said, right, I'm going. This is me gone. Right, I'll see you in a few years. And I came back after 3 months, and I felt like a failure. I really felt like a failure.
Interesting.
Because, a bit embarrassing as well. But what I learned from that is that I didn't want to work in a factory for the rest of my life.
Yeah.
And the life is the world is not going to give me a living. I've got to go out and make it myself.
Absolutely.
So I think that was a pivotal point in my life when I then went to university after that. And since I went back to France, you know, after 3 months, I went back and a few times again. I kept trying it, but putting myself in that position of discomfort, taking myself out of my comfort zone, I think has helped me psychologically or philosophically to keep doing that, isn't it? Perhaps even with podcasts.
Yeah.
So yeah, I think that was I saw that as a failure of myself at the time, but retrospectively, I think it helped me grow as a person and made me want to succeed in life.
I love that story. And, you know, I don't know how old your children are. I have 4, and they're all the way from 22 to 12. And so, but you know what? That story of being an 18-year-old is so important. And it was probably hard for your parents. And he's like, they were probably scared to death, and that thought they might never see you again. And then 3 months later, you're like, you're back. And what a great story. And that's what I like to tell, you know, youth is like, you know, you have a lot of time in this earth, and it might be only fleeting, but you have a lot of time to decide what you're going to do. You know, really you do. And it doesn't take very long if you go try to find something to know what you don't want to do. And then you can actually say, hey, you know what? Here's what I'm going to set my mind to do, and I'm going to move forward. And it takes some people longer than others. It might take years, but Aaron, that is a great story. I love it. And I can only imagine maybe when we get to see each other face to face, I'd love to hear more about those France stories. Cause I know those 3 months you probably have more stories in those 3 months than you have of a lifetime of other things, of the challenges, and probably living day to day, not knowing what you're going to eat, not knowing where you're going to sleep.
Yeah.
Incredible. And now, you know what? Congratulations. You are a vice president of a major corporation. That is so cool. Congratulations. I'm very proud of you. I love stories like yours. Bring chills up my spine. I love to hear those stories. Maybe you're okay. Yes, you are English, but you've lived the American dream.
Don't hold that against you.
I won't hold that against you. No, we're like brothers. So that's really good. And so you've lived the American dream. That's what we call it here anyway. And you've lived a dream of making something of yourself. And you described that. Nobody's going to give it to you. You have to go earn it. So really good job, Aaron. This has been great. I've loved talking to you about Sciex and you and your personal stories and illness to wellness. And I've learned so much from you. I really, really appreciate it. And I have a feeling that we're going to see each other very soon. Let's just say that. And I look forward to that, and I look forward to more of your guys' products and the rollout and the launch. And so thank you very much, Aaron. This has been wonderful. Let's be in touch, and this will be available, everybody, on iTunes, SoundCloud, Spotify, and YouTube in a week or so. Go there or go to my website, drsneedham.com, where you can see more of my platforms. Join me on Facebook, on LinkedIn, on Instagram, and you can find me there and find all this information as well and follow my life. And thank you very much, Aaron, and we will be in touch. Thanks again. Have a good day.
Thank you.
Bye.
Goodbye.